I wish we could almost end there. It's such a great message. And I think, we've done this a little bit on the peer reviewed for presentations on the AI at a very tactical level. It's one of the things that we really believe in makes a difference for this. But I think you're taking it up a level of saying, like, look, we need to really show evidence for these things so that we can establish best practices. And, minimally for that, not just, so it's not a marketing thing for companies. It's a real kind of transformation of care things for hospitals. I want to zoom out, and I'll ask both of you this question. I'll start with Holly because she's our guest. Holly, prediction time. 3 years from now, where do you think we're going to be at with virtual nursing? And some of the AI things that we look, are those step 2 or are those necessary for us to even get beyond the pilot phase with step 1? How do you think about kind of the next 3 years of virtual nursing? And I'll let Tiffany chime in after that as well.
So I think 3 years is still going to be a large part of learning, and then some additional adoption, because I think it is going to take a while for us to really get to a point where it's standard of care. That was the same thing that happened with electronic health records. There are now, the majority of the workforce has never worked without an electronic health record. I predict we're going to get to that same point with virtual nursing. The majority of the workforce will never have worked without a virtual nurse.
Mm-hmm. Yeah, and I have to agree with that. I don't think also that will be in the next 3 to 5 years, but right. I do agree also, there's going to be a lot more adoption, people interested in wanting to learn about virtual nursing. I think on the nursing side as well, nurses are going to start to be a lot more interested in virtual nursing. And what is this? Because, it has pretty much, if you've been a nurse, you have a couple tracks and they're mostly in the hospital. So this, I think, will also gain interest in the next couple of years from nurses wanting to learn about virtual nursing and be a virtual nurse. I think that also people are going to realize that the impact, to make a huge impact, you really do need that device in every room to get those AI, or at least on a unit. And I think certain vendors will also understand we need to support the hospitals with their needs. And I'm proud that Look Deep does that.